Deborah McCormick, 14-year-old female, GCS 13, possible overdose.
Dr. Choi, April, you're going to treatment 4.
We got it.
Found her in Lower Wacker, passed out and freezing. Probably homeless.
Not homeless, damn it. I live with my friends.
Okay, can you tell us what happened?
Nothing, I tripped and fell. I'll be fine.
Let's transfer on my count. Ready, 1, 2, 3. Let's get her started on IV fluids and order a tox screen, CBC, CMP, and a white count with differential.
Yes, doc.
Do you have a family member we can contact?
No.
You sure? Call child services.
No, please don't do that. They never help. They just keep sending me back to my mom and her drunk boyfriend, and he hates me.
For now, you just rest and get warm, okay? We'll run some tests and be back to check on you soon.
What do we do?
She's a minor. We have to call child services.
Not if they're just gonna put her back in an unsafe environment.
We don't even know she's telling us the truth.
Ethan, I've seen this too many times. Child services sends a girl home. She winds up right back here. Beaten, raped.
What good is calling child services? She's already been through the system. She still ended up in the street.
So what's the answer? Just let her be homeless? A 14-year-old girl?
Looks like this young lady's in a tough spot. Most potential foster parents are only interested in babies or young children. It's nearly impossible to place a teen. Does she have any extended family?
Not that she's told us about.
Well, April's right. In all likelihood, child services will just send her back to the abusive home she fled.
But they'll follow up, make sure she's safe.
In a perfect world, yes. In reality, they don't have the resources. Let me call some contacts in social services, see if there isn't a group home with a vacancy.
Thank you, Miss Goodwin.
Thank you.
That's my cousin, Kiki.
Hey.
Hey, your labs came back negative. No sign of infection or any immune deficiencies.
Great. Kiki's coming to take me home.
No, we can only release you with the permission of a parent or legal guardian.
Forget it, I'm still going. Kiki, which...
Deb! What's happening to her?
She's seizing.
Step back, step back. Deb!
3 milligrams Ativan. Call radiology. We need to get her upstairs for a head CT now.
Ativan in.
Okay, bud. Okay. Ready?
Yep.
She's got a mass in her sinus, possibly a tumor. We need a biopsy.
Yeah, but look at the cross sections.
I don't understand.
Neither do we.
It's moving.
You feeling any pain, Deb?
No, it just feels weird.
Stop moving.
What was that?
I have a pretty good idea. Forceps and speculum?
Oh, what's happening?
Just stay still.
A cockroach.
What?
I want to take another look at that CT.
How did a cockroach get up my nose?
It crawled. It was attracted to the glucose in your cerebral spinal fluid. It's sweet.
Ew.
Where do you live? Never mind. I'm gonna go scrub for surgery.
Surgery?
Your cerebral spinal fluid is leaking into your nasal cavity because of a small cranial fracture. Have you had a recent head injury?
Did somebody hurt you? You can tell us.
Look, I don't want to get involved with the police.
Just tell him, D. My mom's boyfriend. He hit me. That's why I won't go back. Still think child services is the right call?
I understand. Thank you. I got Deb on a couple of wait lists for group homes, but none of them have a room available.
So where does that leave us?
I could speak to child services, make sure they know about the abusive boyfriend.
Even if the boyfriend leaves, odds are the mom's gonna allow him to come back.
But when Deb gets out of surgery, she'll need a clean place to recover. She's not gonna get that on the street.
Well, you both make good points, but as the physician on this case, Dr. Choi, it's your call.
There was a cockroach in her nose. I'm sorry, April, but we have to call child services.
How are you feeling?
Okay, I guess.
Dr. Abrams said everything went great. And the paramedic who brought you in dropped this off for you.
Great. Did you call child services?
I'm sorry, Deb. There was nothing I could do.
What's he doing here?
Don't worry, he's here to help.
Who's Deb?
This way. I'm not going with child services.
I'm not here to take you away. That's your antibiotics twice a day with a meal. We make sure she takes these. April's gonna show your friends how to keep the wound clean.
Thanks.
Let me take a look at that dressing.
Dr. Choi, that homeless girl that you treated a couple of months ago, she's back with her friend. They're asking for you.
Hey, Nat. You free? Kiki, Deb, you remember Dr. Manning?
Hey.
What's going on?
Oh, she's really sick.
BP's 102/68, heart rate 112, temp 100.
Stomach hurts, headaches.
You are running a fever, so let's take a look and see what's going on, all right?
Hey, Deb. You're looking a little under the weather, too.
I'm just tired.
Still living on the streets.
It's okay. Not so cold.
Her liver is slightly enlarged. I'm gonna be sick.
Okay. We can help you with the nausea. 4 milligrams of Zofran.
We'll run some tests. Let's get a CBC, BMP, LFT, hepatitis panel. Whoa, whoa. Let's get Deb into a room. Take a look at her.
Okay. Come on, I gotcha. Better run the same labs for Deb, too.
Yeah.
We have a public health issue.
Liver panels came back. Both Kiki and Deb tested positive for Hep A.
Oh, no. We need to admit them to the PICU.
Yeah, but then what?
That'll only be for a couple days, then they'll want to go back out on the streets, and they'll be contagious.
Highly contagious.
We have to report this. I understand they live in some kind of encampment.
Yeah, with a bunch of other kids in close quarters.
It's got to be cleared out. DCFS will have to find homes for these kids. Meanwhile, let's get a team over there to see who else is infected and immunize everybody who's been exposed.
Natalie and I should go. We've treated them. They know us. April too.
Okay, I'll stay and look after Kiki and Deb.
All right.
Gone down, heart rate and blood pressure have improved. All good signs.
What about Kiki?
She's doing better too. Maggie, Deb and Kiki are both stable. We can send them up to the PICU.
We got more coming in. Dr. Manning, you're going to treat me too.
16-year-old female, suspect Hep A, febrile and hypotensive.
Now she's shivering and throwing up, and I don't know what to do.
Deb, what's going on?
Her homeless friend is 9 months pregnant and has a fever. She needs to come in.
But she won't, right?
No. Would you come out and help her, please?
Not when she's this far along. She needs to be monitored and have emergency measures nearby.
Dr. Choi.
Let me get some supplies.
Hey, wait! Hey! You're just gonna go treat a pregnant girl on the streets?
I've met some of these kids. They're underage. They know that if they come in, they'll get put in the system.
Yeah, but she's 9 months. She's gonna have to come in eventually to have her baby.
But she needs to be assessed now. Nat, I could use your help.
Seriously? Fine.
Thanks.
Text babysitter. Cold pizza is Owen's favorite breakfast. There's some in the fridge. Tell him I love him. Send.
I'll send your message.
She's over here.
What? I wrapped her up, but she's still shivering.
Laura, I'm Dr. Manning. I'm gonna take your temperature, okay?
Let me take a look.
103. You most likely have an infection. It is very important that we treat it before you go into labor.
Okay, but my water broke. What does that mean?
When did your water break?
2 days ago?